those lab values, some of those really important ones that you want to commit to memory. Now, if some of y'all are creative and can think of very creative ways to remember this stuff, I encourage you to share it. For now, I have not thought of creative ways to remember these numbers. They're just numbers we have to memorize. Which means for me, this is the first stuff I'm going to write down on my scratch sheet before I start my test. Because this is stuff I personally forget. Now, what are the big ones right there? This is going to apply for not only X-ray, but for CT and MRI. These are very important numbers that we always check to make sure they're going to be able to handle a contrast exam. Most of the time, it's going to apply to things like your myelograms or your cystograms. And if you don't know what those are, we're going to hit those next semester more specifically when we start going through all the fluoroscopy. Now, BUN, what's it stand for? Blood, urea, nitrogen. What's the normal range? It's going to be from 7 to 21. We want the BUN to fall within that number range. Otherwise, we will not do the contrast study. I'll say it again, we need the range be between 7 and 21. Otherwise, we will not perform the contrast study. So you can probably think of an example question right off the bat there, how they would ask it. Patient presents for a cystogram. BUN readout reads 5. Will you proceed with the contrast study?
No.
You would say no. If it asks why, because BUN is below the acceptable range. Making sense? Same thing for your creatinine level. It's another number that we check. That range is 0.7 to 1.5. Creatinine is 0.7 to 1.5. Yes?
How are these measured? In parts per million, or?
How are they measured? They usually do like a blood draw, and they send it to labs.
So it's like, is there a unit that we need?
For
to
these, no.
Okay.
There's not. And then GFR. Now, I want you to keep in mind, BUN, creatinine, and GFR are often always together in a trio. When they do those labs, that printout will come back, or you'll go in Epic, and you'll look at those three numbers. It'll say BUN, creatinine, and GFR readouts. GFR stands for glomerular filtration rates. Which, what do you think that's referring to? Glomerular filtration rates. The kidneys, because within the kidneys we have nephrons, and part of the nephrons what we call the glomerulus. Which, if you have no idea what I'm talking about, we're going to break that all down next semester when we talk about kidney anatomy. But it's basically a fancy way of saying how are my kidneys going to filter the contrast, which is why we need it to be within the normal range of 90 to 120. If it's below or above that number range, that means that there's a very big danger. If I put that contrast in my system, my kidneys are basically going to get clogged up and not filter it right. And it's going to cause what we call toxicity or infection within the kidneys, which can actually kill you in some cases. Yes?
I had a doctor yesterday that came and she was like, oh, this patient has low GFR. So I asked the tech, like, what does that mean? Because I was like, I know y'all look at the creatinine. So I know here we're looking at GFR.
They actually look at all three, but that was probably the one that's sticking out as too low. So that's a big deal. You know, if that's something that we overlook, or the doctors overlook, we can threaten the patient's life. Kidney function is a big deal. If kidneys get messed up, you're either going to be dead or you're going to be on dialysis the rest of your life if you damage those kidneys too bad. And if you ever see a dialysis patient, it's a miserable, miserable existence. I used to do x-rays on dialysis all the time on children. I always felt so sorry for those kids because they were always in the worst shape. It's horrible. Yes.
So, legally, what would be the issue there? Is it negligence? Is it assault? Is
Like
it
if you
malpractice?
administer it. That's a really good question.
There you go.
That's a really good question. What would be the legal jargon if I administered contrast and did not pay attention to the numbers? I believe that would be gross negligence, if I'm not mistaken.
Not malpractice?
Hmm?
Not malpractice?
I don't think it would be malpractice because you're not doing the wrong exam. Malpractice is more so for like doing an incorrect procedure. This is more so like a negligence to look at the details.
Okay.
Might be a little overlap there, of course. And some of these laws, which we're going to review today, have some overlap here and there. But you kind of go with the best answer of the two. What's it lean more towards? And in this case, I believe that would lean more towards negligence.
Okay.
Now, GFR. Once again, that's how the kidneys filter urea and creatinine. We have urea and creatinine in our blood. As urea and creatinine
Urea and
I can start there. As urea and creatinine increase, the kidney function will decrease. Very important point to put a star by because we're really going to hit that hard next semester. And that's one of those patient care questions that can throw people off because we don't talk a lot about urea and creatinine, but I included it because I've seen that come up as a question. As urea and creatinine increase, the kidney function actually decreases. So what would be the inverse of that, guys? As urea and creatinine decrease, kidney function increases. Always think of the opposites when we talk about this stuff. Think of it both ways. So you're covering that entire spectrum of the types of questions they can ask you. Question?
Mr. Donahue, isn't it the opposite? The kidney function, if it's not good, then the urea and creatinine should increase, right?
That's what we just said.
Yeah.
But if kidney function decreases,
That means it's not working like it should. It's-
that's what the urea and the,
Right, right. Don't overthink it. Don't overthink it. All right, PT. What's PT stand for? It's something else we're going to check. Prothrombin time. Also very important for all our venipuncture type exams. Now, what is PT? That's the time it takes for the liquid portion of our blood to clot. So it's a clotting factor. Why would that be important? Well, if someone does not fall within the range of 11 to 13.5 seconds, what do you think is going to happen to them if I stick them and they bleed? They might bleed to death because they're not clotting. So PT has to be in the correct range for it to clot properly. And something as small as a needle stick can actually cause someone to bleed uncontrollably if their PT is off basis. Therefore, if I saw a PT time of 9, that tells me I shouldn't be sticking that patient. I shouldn't be doing anything that's going to cut them or cause any kind of bleeding because they're not going to clot properly. I want to be within that range of 11 to 13.5 seconds. On the same basis, we have PTT, partial thromboplastic time. Now, what's that? That's the time it takes for the blood to coagulate. What's coagulation? Like you ever see what blood does when it's outside the body and it hits the ground? It gets kind of crusty and hardens. That's coagulation. It's coagulation. It goes from the liquid to a more solid state. So we have a range for that too. The normal range being 25 to 35 seconds. Now, if a patient presents with high PT, I probably should put that after this bullet point. I'm sorry, high PTT and high INR, which I'll talk about in a second, that's going to lead to a lot of our interventional procedures. A lot of your IR cases are due to these 3 numbers being out of range, being too high. So when you're in IR, I want you to listen for that, to listen if they're talking about high PT, high PTT, or high INR. It's very likely one of those factors is too high, and that's why they're having that interventional procedure. You had a question, Melanie?
Yeah, I thought clot and coagulation.
Coagulation, so 2 different things. Clotting is basically you're just stopping the blood from bleeding. Like if I cut myself and I put pressure on it, it's going to clot, it's going to stop bleeding. Coagulation is when the blood's outside the body, how quickly does it turn to a solid state? Similar but not. 2 different things. Now, INR, that's our international normalized ratio. That's another coagulation measure. So PTT and INR both measure coagulation, while PT measures clotting. Please remember the difference between those. So INR is basically just another way of measuring PTT, which is the coagulation time. They both are basically the same thing. 2 different ways of saying the same thing. So INR is just the international normalized ratio for coagulation, and that range is going to be 0.8 to 1.2. You can use either one to measure the same thing. Make sense? 2 ways of measuring the same thing.
And PT measures clotting?
PT measures clotting. Once again, my creatives out there, if you've got some good ways to remember those, please share. I've yet to come up with something on those, but if you have a little light bulb moment, share it with the class.
PT is within the body.
Yes, it's your clotting. And then platelets. What are platelets, guys?
part of the
They are
blood.
part of the blood cells. Well, they're not the actual blood cells. It's separate from the blood cells. What do our platelets do? We're going all the way back to elementary school. We have red blood cells, we have white blood cells, and we have platelets. That's basically what helps you clot, guys. They're the little bodies here to help clot up the wound. So, once again, we want that to be within a good range. If I have too little platelets, am I going to clot? If I have too many platelets, it's probably going to do the reverse and overclot, which can cause an actual blockage.
Saturation.
Blockage, yeah, or oversaturation. Those fancy words, that's, yeah, okay. 150,000 to 400,000 is the platelet readout. We want to be in normal range. Normal range.
Quick question.
Yes.
You know, whenever you donate blood and they tell you, okay, do you want to donate platelets? Is it good to donate platelets or it's not good for your body?
Because people have platelet deficiencies. Because they have plasma deficiencies.
Is it good for your body or?
if you're healthy, your body replenishes that stuff quickly.
Oh.
Like I have to do blood dumps every once in a while because I have high hematocrit levels. So my blood's really thick.
Oh.
It's not unhealthy for me to donate blood. It helps other people, but I have to do that to keep my blood thinner. Because if my blood gets too thick, Mr. Donahue might be passing out on the floor, having a heart attack, which Lord, heaven forbid that happens. But you gotta take care of yourself.
You'll be
One
so
more
scared.
time, can you, okay, so INR and PGT are coagulation.
INR and PTT are coagulation measurements. PT is clotting measurements. And then platelets speak for themselves.
The platelets you can donate every like 7 days, right?
Something like that.
And then the blood is like every 8.
And plasma, they pay you to donate plasma, I believe.
Mm-hmm.
You,
Not very much, but you can.
you make new plasma?
Your body replenishes all that stuff.
Um,
Oh yeah, you can't go over every day. I mean, you can go pretty. I think what 7 days?
Yeah,
I think your
5
body's fully
days.
replenished in 7 days.
Mhm.
All that stuff, if I'm not mistaken. Are we good on lab values so far? Questions?
did you want us to memorize these exact numbers?
Yes.
These ranges of-
Yes, I do. These will come up.
Are these all fair game on our check?
These are all fair game.
We never learned.
But-
Everything in patient care is fair game at this point, guys. Huh?
We didn't learn these.
We didn't learn this. We're learning it now.
Mm.
We're
That's
filling
what I
in, we're
think
filling in the
today.
gaps
I
because
thought those
I've
movies said you're
seen
learning everything
I
new.
have seen the types of questions that are coming your way. I think Jay was next. I'll get you in a second, Veronica. Yes.
I was just gonna ask, like, where are there specific parts where, let's say, thrombocytes or platelets or things form? Because I know that bone marrow and or red bone marrow, yellow bone marrow.
If I'm not mistaken, it's all within the bone.
the same
far as I
size?
know.
Okay.
Veronica?
Are the ranges specific? Because
Yes, they are.
sometimes they can be a little bit off.
These are the most common ranges I've seen as far as the questions go. So you might see slight variances, but this is the most likely scenario of what you're going to see. But even with slight variances, they should still be very similar. Yes. One more question before we move on. Yes.
Sir, what's the difference between coagulation and clotting?
You tell me. I've just said it 3 times.
Sir, I just Googled also and it says the same thing to me.
Clotting is stopping blood from bleeding. I'll make it as simple as possible. Clotting is pressure and stopping the blood from flowing. Coagulation is the blood going from a liquid to a solid state. Yeah, they work together. They do work together, but they're 2 different processes. Yes. All right, let's move on, guys. We got a lot of slides to get through here. All right, so I want y'all to write these down because these have been coming up on questions as well. I've added some slides in here on top of some of the things you've told me to supplement, and these are going to be what we call our common pulse points. Now, when we're talking about saving someone's life, CPR, activating the emergency response system, these are our most common pulse points. Now, when a patient comes to the trauma room, of those 5 listed, what is the one that is most used? The carotid at the neck. That's what you always see on TV, it's what you always see in the movies, what you also see in the trauma room. At least I hope so, yes? Carotids at your neck, just like on the midline. But just because that's the most popular or the most common one used, does not mean we cannot use these other ones as well. We have the radial, and please know where these are, at the wrist and base of the thumb, and you can feel that yourself. We have the temporal in front of the upper ear, not at the ear, in front of the upper ear, which is basically your temple. We have the femoral, which is the inguinal region or the groin, right here, guys. Not the most popular spot to palpate, but if you have to, you have to. And then the popliteal, that should sound familiar. Where's that popliteal at? We've talked about the popliteal.
Behind the knee.
The back of the knee. The back of the knee, correct.
P and P.
P and P. So those are our 5 most common pulse points. Not all of them, but the most commonly used. Please remember those. Huh?
Not brachial.
Brachial is more so for pediatrics. It's talking about your common adult patient. That's a good point to bring up if you want to write that down. Brachial, when you're doing the emergency response, check pulse, that's going to be for infants. Brachial pulse is for infants. You can go ahead and write that down. That's actually a really good point to bring up.
Gold star.
That's a very good gold star. We're gonna go more to pediatrics next semester, but yeah, huh?
Infant and pediatric?
Infants only.
For brachial.
Infant, what's the infant age range? That's a year and below. Infants are brachial, children are also carotid for the best spot to do emergency response pulse check. So from 1 to puberty would be child or pediatric. They are done just like adults, and that you're gonna choose the carotid vein to check pulse. The only one that differs is infants, and that's 1 and below. You're gonna use the brachial to check pulse. And where's the brachial at? Inside the arm near the humerus.
What's the age? You said a year and.
A year and below would be infant. A year to puberty would be pediatric. And then after puberty, it's adult. And those pictures show you a few other pulse points as well. But once again, those are the 5 most common that we're going to use, especially when we're talking about the emergency response system. When I say emergency response system, that's like CPR, someone's unresponsive. Remember, by the way, great questions to review. When we activate the emergency response or someone codes or passes out or is unresponsive, what's the first thing we do? Call for help. Then we check pulse. If they're unresponsive and there's no pulse, what do? You start CPR, correct. In that exact order, guys. And I'm saying that because people always forget to call for help first. They always want to start CPR right away. They might have a heartbeat and you're like breaking their ribs and doing CPR. But you gotta go in that exact order. Call for help, check pulse. If there's no pulse or they're unresponsive, you begin that CPR right away.
Get help, 'cause I get out of breath too fast.
CPR is hard work.
Yeah, I know.
It wears you out. Especially because to do it right, you gotta break ribs. Wise doctor once told me if you ain't breaking those ribs, you're not doing it right.
I have a
That's
question.
true.
Is it breaking ribs or the cartilage?
You're breaking the rib. Well, you fracture ribs with CPR. Yeah, if you're doing it correctly. Yes. Okay. Also make note, these are also what we call arterial pulse points. Arterial pulse points. Those 5 we just named. They're not veins, they're arterial pulse points. Which is why they're the most common, because they're more accurate to measure. Arterial pulse points are more accurate to measure than the venal pulse points. I'm giving you all kinds of questions here.
Oh, say that one more time. I was laughing at that.
The 5 most common pulse points are what we call arterial pulse points, and arterial pulse points are more accurate than the venal pulse points.
So the brachial, would that be a venal?
Is it what? Brachial vein?
Oh.
Is this helping so far? Refreshing?
But can you really quick go back to the last slide? I think I misspelled in green. Okay, thank you. Okay, thank you.
We compared smartwatch bands?
Yeah.
That's the real important stuff.
No, I'm taking those, don't do that.
Okay. Just making sure. I gotta get me a new smartwatch, but I won't charge anymore.
Yeah, Apple product, we don't have Samsung product.
So we're not to use the pedal.
Yes?
We're not to use the pedal to check for, like, or rather, in what situation will we use the legs and feet to check for arterial pulse?
When would you
Yeah.
use those?
Like-
If you just can't access the carotid typically.
Okay.
It's just basically ease of access. Let's say they come in with a really thick neck collar and all this stuff in the way, you can't even get to the neck. So you're gonna choose one of these other ones. to
So you
check
just
that
tickle their
pulse.
feet and make sure that,
Tickle the feet?
yeah, just like, alright,
No,
you got it?
tickling the feet. You know what tickling the feet's used for?
Reflex to see, check the reflexer.
No. We only tap or tickle the feet on infants
The babies.
to check response because you can't shake a baby.
Better not.
You might be trying to help, but CPS is gonna come and bust you up if you do that. You flick the feet or tickle the feet of a baby to check if they're responsive, because babies will react to that. All right, what about our normal resting pulse rates? We're still talking about some vital signs here. These are, and once again, there are slight variances depending on the text you use. These are the most common averages you're gonna see in the question formats that I have been giving. For men, 68 to 75. For women, 72 to 80. Children, 70 to 100. And infants, 100 to 160. All four of those are very important to know. Once again, a child is 1 year old to puberty, while an infant is 1 year old and below. 1 year old and below. Now, why do these children and infants have such a higher heart rate? What's going on here?
The body is small.
The body's smaller.
So does that have to travel?
It's part of development. So the younger you are, the faster your heart beats. So a lot of people will go in there, and especially if you see a baby with a exposed heart or a heart that's overgrown, you can see it beating really fast. And if you're not knowledgeable that the heart rate is supposed to be that fast, you might go, oh my goodness, that baby's hyperventilating. But that's normal. It's supposed to be faster. It's part of development. It's going to naturally slow down as the body expands and grows. By the way, exposed hearts are really weird. If you've never seen that before, we see that quite often. Dextrocardia, not dextrocardia. Dextrocardia is the backwards heart. Can't remember the exact word for it, but some babies, their hearts are too big to fit in their chest, and they're born with the heart outside the chest. And they will wait till the baby develops more, and they'll place it back into the chest cavity once they're old enough. Really weird stuff. Yeah.
Quick question, so the range of the pulse is not 60 to 100?
The range of the pulse.
Yeah, that's what it says in the
On the,
children, it's 70 to 120.
So I
Just
said here,
making sure, 'cause I have
so
that on my
you're gonna have
notes.
slight variances. These are the most common ranges as far as the question types you're gonna get. You will see slight variances, but these are the numbers I want you to focus on. This is what's gonna reflect on your registry, on all my cross-referencing. So I make those little corrections, or write that down, or take a picture. I do realize there are some variances in the text.
Well,
But
this
these-
is rest.
This is your normal resting pulse rate, like just your normal pulse, like you're all having normal resting pulse rates right now unless you're like freaking out about all this information. Some of y'all have some really low pulse rates because you're yawning over here. No. It's early, I'm not judging. These are the most common ranges though, through all the cross-referencing I've done and question types of what the normal resting pulse rate should be.
oh, wow.
Still right?
So if it's closer to 52, that's bradycardia?
Yes, it would be. It could be indicative of bradycardia. If it's below, if it's above that range, it would be
Tachycardia.
tachycardia.
What of like, let's say 110 in adult male? Is that supraventricular or is that?
It could be. That could be a heart arrhythmia. Yeah, your heart rate should never be going above that 100. Like unless you're like, I mean, if you're working out and running, that's one thing. But if you're like just sitting like you are and your heart's going boop 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 boop, boop, it's like we got some ventricular fibrillation or something going on. Yes.
What was AFibs again?
Atrial fibrillation.
AFibs range? Was it a specific value or was it just how it looks? Okay.
I can't recall it off the top of my head. Okay, guys, this is a little bit more about blood pressure because these are terminologies I have seen coming up on the exam for patient care questions. This may look familiar to some of you, it may not look familiar, but I want you to write this down because this has been showing up on the registry. What is blood pressure affected or measured by? Gold star, these 3 points right here. It's affected by your cardiac output, your blood volume, and your vascular resistance. Those 3 factors are what affects and measures your blood pressure. Please write that down, put a big gold star on it, those 3 points. How do we measure? We're not often going to see the word stethoscope. We're going to see that mouthful of a tongue twister there, the sphygmomanometer. Hey, I said it right the first time, there you go. Sphygmomanometer is the actual scientific term for what we use to measure blood pressure.
We measure, we use both, because we have both, so is it both, or just the big one?
You're most often see the big word.
Okay.
Yeah. We use both, but you're most often going to say sphygmomanometer. Colt inflation, what's that do? That collapses that brachial artery, which is how we start measuring the blood pressure. So when you have that cuff and it's squeezing your arm, you're collapsing the brachial artery, you're releasing the tension, and you're going to start measuring that pumping that you feel in your arm, and they start releasing the pressure. The first sound you hear when you have the stethoscope on the vein, you're going to hear the systolic pressure, followed by the diastolic pressure. Systolic is the top number. Diastolic is the bottom number. Remember that? Gold star on that first sound you hear is systolic, while the second is the diastolic.
Which is when the heart is at rest.
Correct.
I know that now after I took your test.
Huh?
I know that now after I took the
Oh, okay.
comprehensive test.
Good.
And you told us to remember it by the second sound is distal, like distal
I think someone
diastolic.
had mentioned that. I don't know if that was me that mentioned that, but
Oh.
someone did. That's a good way to remember it. If it helps.
Yesterday there was a patient that was kind of like changed, like his state of mind or whatever changed on the way to the ER. So everybody was looking for a stethoscope and nobody on the floor has that.
Really?
Yeah, like none of the nurses.
You think that's almost like there'd be like a million of them
So
sitting
they were
around.
like, oh, where's that from?
They almost always held
Like-
around their necks and stuff.
That's what I thought too.
Nurses.
We
Epic fail.
don't I have one, my teacher very focused on.
He knows.
You know what's
He's
funny?
like TCH could
You
never.
didn't hear that.
Mr. Don, you know what's funny? When we graduate, Miss Bunny is gonna graduate with us.
She
From
is,
MRI.
because she's going to be an MRI, yes.
So she's gonna be up there saying a speech. Cause you know how all teachers give a speech.
Mm-hmm.
Right after that, she's gonna go up and
She's gonna
say-
walk too.
That's
Yes,
cool.
indeed. Possibly. All right, we good on that? Okay. Very important pathology that shows up on a lot of questions. People forget this one. We're going to be going over a lot of pathologies, more so in the positioning, but we'll start hitting on some as well for patient care. Dyspnea. What is it? Difficulty breathing. You got to be able to identify what that word means or it'll throw you off on the question. Dyspnea is simply a difficulty in breathing. Please remember that term.
Apnea is not unable to breathe.
Huh?
Apnea
Apnea
is
is
unable to breathe, not breathing.
a cessation of breathing. Cessation of breathing. I'm trying to use the actual terminology. It's cessation of breathing.
Dang, you're killing it with the big words today.
Huh?
You're killing it with the big words today.
Coffee's hitting good today, you know? It was those Pockies. I'm gonna drop dead.
Oh.
What?
Oh, I think you have a drop.
Oh, I think I was gonna drop dead. Like,
Wow.
Yeah, you
goodness.
gotta, you gotta.
Tell me how you really feel over here.
You got a whole bunch of students that know CPR. You gonna be okay.
Someone's gonna break your
Y'all,
ribs.
no, y'all all gonna be like pulling your phones out, like, ooh, let me record.
Somebody's gonna break your ribs.
My teacher passed out.
Mine is 5.
I'm not that generation, so I'm gonna try and save you.
Hey, extra points.
Okay, I
extra
appreciate
points
it.
if I can bring you back, right? Extra points if I can bring you back, right?
Let's see, you know.
Somebody get the jumper cables.
Okay. A great chart here, guys. If you want to take a picture of that, that's indicating some conditions the patient might be having based on their blood pressure. So, average normal adult systolic blood pressure should be less, not more, less than 120 millimeters of, what's HG stand for? Mercury. Mercury. Make sure you know that's the units we use for blood pressure, millimeters of mercury. Why they use HG? I think they were just being trolls back in the old days when they came up with all these chemical abbreviations, because there's not an H or a G in the word mercury. Not sure what they were doing there. I think there's an explanation for that. I can't
Is it
remember.
Latin?
I don't know if it's Latin or it's like the person's initials or something or another. I discovered it, but anyway, I'm off basis. The average normal adult diastolic blood pressure is going to be less than 80 millimeters of mercury. Once again, systolic, top number is the contraction, while diastolic is the relaxation. I'll be repeating a lot of these terms because repetition is good, guys. Repetition works. So it sounds like I'm repeating myself. I am. You need to repeat it to solidify it in your brain. So, blood pressure categories on this chart. So when we're normal, we want less than 120 and less than 80. If we have elevated blood pressure, we have elevation of 120 to 129, and we're still less than 80. That's what we call elevated blood pressure. High blood pressure, in what we call the early stage of hypertension, is 130 to 139 and 80 to 89. Very subtle differences, by the way. Not a lot of variances as we go through each of these. High blood pressure and what we call more advanced hypertension or stage 2 hypertension is going to be 140 or higher and 90 or higher. And then hypertensive crisis, and you better get your butt to the hospital, higher than 180, higher than 120. Really great chart to reference right there, guys.
Are we gonna talk about ejection fractions?
About what?
Ejection fractions? Like
Ejection
EF,
fractures?
how much actual volume is ejected from the
Oh,
heart
yeah, I've
per-
got, that's when we get to the heart section,
Okay.
towards the end, yeah. We okay so far? We all on board still?
Yeah.
Okay, I think the next one's only some of our laws. Say yes. And before we get to these, because I don't want to break it up, let's take our first break. It's 9 o'clock. Let's take 15 minutes, stretch, get some coffee, get your blood flowing, I need y'all awake, I need y'all engaged, and come back at 9:15.